Welcome, everybody.
Good evening, everybody.
Hope you can hear us tonight. This is the Wellness Revolution with Dr. Robert Wiedemann and co-host Marvin Robb. Of course, I'm Doc G, the announcer. This show is for information, educational purposes only, but it also may not be. This is for July 20th, 2026. Welcome, gentlemen. And tonight we're going to be talking about what? Kidneys and other things.
Kidney disorders. Yeah, we're going to be talking about kidney disease, bladder disorders. We're going to talk about the ureters, the urethra, and so forth. So, Marvin, you want to bring up the PowerPoint there and start going through this stuff? And if you've got some videos from Dr. Wallach, we'd appreciate that.
Sure. Let me go ahead and do a screen share here. So hold on here. Okay. Can you see that?
Yes, I can see it. Mm-hmm.
Minerals and hydrolytic potential. Okay. So for those of you who've never heard of us or just new to the show, welcome. Dr. Wiedemann, can you give just a quick intro how they can get a hold of us?
Yes, if you want to text me at 406-270-3754, that's the easiest way. And if you need to email, just send an email to healthreform90@gmail.com for now. Okay, so anyway, for tonight's show, Marvin, we're going to be talking about kidney disorders and what kind of signs to look for, if you have some troubles with your kidneys and so forth. And some potential things to some remedies to deal with this, so forth. Natural remedies. Of course, the first line of defense is always your central nervous system. The nervous system, keeping your spine in proper balance is always your first line of defense. The very first and fastest line of defense is to take care of that spinal column, make sure it's properly in balance, in proper adjustment. Now, adjustment means when I say in adjustment, I mean that a procedure was performed to analyze your spine in relationship to what's considered normal. And there is an established normal to the spine. When it departs from normal, it can interfere with the function of the nervous system. Structure and function are related. Okay? So when your spine is in proper balance, that means that there should be free signaling between your brain cell and your tissue cell, and proper control over your body, over your spine, and so forth. But beyond that, we want to make sure, because here's what happens. Number one, when you have interference over a long period of time, it can create nutritional deficiencies. Why? Because your organs of assimilation can be interfered with by nerve interference. In other words, your stomach, even your teeth, your mouth, the function of your glands, your mouth, your stomach, your intestines can all malfunction as a result of interference with that nervous system. So that can create digestive issues. So we have to come along and do some remedies to reestablish the proper flora and fauna within the digestive system. You have to be able to assimilate those things that we need in order for your body to have the engines or the resources to repair and rebuild and reverse your disease process. Okay? So with that, Marvin, what do you have for us today here?
Well, first of all, as I said, welcome for those of you who have never been here on the show before. We hope that you would get a pen and paper, or this is being recorded live, but you can go ahead and record it as well. But we talk about the 90 essential nutrients. Real quickly, let's introduce you to the 90 essential nutrients before we jump into today's topic. The 90 essential nutrients is based on science. We have learned this from the ag community. There's 60 minerals, there's 16 vitamins, 12 amino acids, and 2 to 3 essential fatty acids, which make a total of 90 essential nutrients. You see that list in front of you here. And so we have in the past gone through this list pretty methodically, but we're just going to introduce this to you. If you want to get a copy of this list, get a hold of Dr. Wiedemann. He can get you a copy of this list. And but every household should have this list of 90 essential nutrients. If you go to Walmart, you go to GNC, you go to any health food store, and you buy supplements, you should be comparing what's on that label on this list. And I walk into homes all the time. I see a whole basket of stuff, and they don't have the longevity label on it. And I look at that, and it's glycemine this and creatine that, and MSM this and that. All of these ingredients are separate out in individual bottles. That's what I call nutritional fraud. Well, it's misleading information. In other words, they don't tell you there's cofactors to magnesium, there's cofactors of calcium, things like that. Now, the kidneys. The kidneys is a vital organ. It's an organ that cleans out the red blood cells as it returns from the cells. In other words, the red blood cells take nutrients from the digestive tract, nutrients, vital nutrients to support and promote, and ideally, you have all the 90 nutrients in your daily diet. They take them to the cells, and the cells then will dump off the waste. The red blood cells on the return will go through the kidneys, and those capillaries in the kidneys are the size of red blood cells. So that strips out all that waste. And so what we have here is that we have actually 80% of all diseases fall within 4 categories: digestive disorders, EFA and cholesterol deficiencies, blood sugar disorders, and calcium deficiencies. Now, we've touched on these other 3 before. Actually, the first 2, we haven't really gone into the blood sugar disorders, but since we talk about kidneys tonight, we're going to jump right into some calcium deficiency, because the kidneys themselves is one of the organs that is greatly affected by a calcium deficiency in our diet. So we have, there's 147 calcium deficiency diseases. And here, I want to show you just something. Calcium, typically, most people think of teeth, they think of bones and joints and things like that, but they don't make the connection to kidneys. Kidney failure is a lack of calcium deficiency. They don't make the connection to elevated blood calcium levels, how that affects the kidneys. Many of you, especially senior citizens, go to the doctor and they get a elevated blood calcium level diagnosis, and the doctor immediately blames the parathyroid gland. Dr. Wiedemann, what's the job of the parathyroid gland?
Well, I was going to mention that the parathyroid is basically the regulator of calcium levels within the bloodstream. Mm-hmm. If there is, it's like a banker. The parathyroids are like a banker, and the bones are like a bank. Okay. And so calcium level gets low. The parathyroid says, okay, we're going to make a withdrawal from the bank. So, if somebody comes along and tests the calcium, oh, you got too high a calcium. For what's happening is that this is all being deposited and making kidney stones. So we're going to arbitrarily make sure you don't take any calcium, and what that does is makes the situation worse. What you do want to do is you want to supplement with calcium. If you have any of these conditions in here, you need calcium supplementation. But Marvin doesn't it has to be balanced with the 90 essential nutrients, and it has to be taken with the right form of calcium. Mm-hmm. There's a good form and a bad form. You don't want to take the calcium carbonate, because that's like the chalk on the old blackboards. You used to write on the blackboards with chalk. That is calcium carbonate. You can't just take chalk and expect it to affect you positively. That will make the situation worse. What you do want to do is get on Dr. Wallach's protocols, and it has just the right type of calcium that you need. And it's not just calcium. Okay. It's the recipe that's in Dr. Wallach's stuff. It's the proper balance in order to and one of the things I want to mention here is that your blood is considered hard tissue because all the red blood cells and the white blood cells are made in the marrow of the bone. So they're considered hard tissue. Okay. So we have to, this whole mechanism here, it's a physiological cascade that takes place. So when you take proper supplementation, then the parathyroid then kicks in and starts storing it back in the bone and starts leveling off the amount of calcium probably that you should have. The wrong approach is to take the parathyroids out. That's a ridiculous thing because these are organs of adaptation. They're regulated by the nervous system, and they're always going to function correctly so long as there's no interference and you're taking the proper amounts of nutrients into your body. They will function right every time because innate always knows. There's an innate intelligence within us that regulates those things. And that's what medical doctors tend to miss out on. They think that the body is stupid. The body is not stupid. The body will do wonderful things if you treat it correctly. And, so many people want to rush to the medical doctor instead of really the biggest doctor is within you. There's a book written called The Bigness of the Fellow Within. It was by B.J. Palmer, and it really talks about this concept of the innate intelligence within us regulating everything that's being regulated within our bodies. You remove interference, give the proper nutrients, and maintain it that way, and your body will do marvelous things. Isn't that right, Marvin?
Absolutely. And just to kind of help you understand something, we're just touching the tip of the iceberg when it comes to the musculoskeletal problem. Now, the kidneys are vital in order for us to be able to function. If some of you may be listening to us and you're on kidney dialysis. Well, what's wrong, Dr. Wiedemann, if somebody's on kidney dialysis? What does Dr. Wallach teach us about kidney dialysis and how somebody can restore those kidneys?
Well, Dr. Wallach teaches that there's nothing wrong with the kidneys actually, except that they're plugged up. It's kind of like when you take a shower, the bottom of the shower sometimes accumulates hair and things like this over the drain. You clean the stuff off the drain and it works perfect. Well, the same thing is true with the kidneys. It can accumulate things in those. They have little nephrons that the capillaries kind of wind around these nephrons. It's like a U shape, and then there's a tubule that empties into the ureter. The ureter is a tube that leads from the kidney down to the bladder. There's one on each side of you, and what happens is that these the kidneys, when they get plugged up, the nephrons are what get plugged up, and it's called nephritis, and it's simply inflammation of the nephrons. And if you get enough hydrogen molecules in there from whatever you're taking, it will solve the inflammatory problem. That's the solution. Hydroxyls are a molecule that causes inflammation. You add a hydrogen atom to that, it turns into water. So not only do you hydrate yourself, but you've solved the inflammation problem. And the Dr. Wallach's nutrients are designed to add those hydrogen molecules where they belong. Okay. And as we empty our bladders and so forth, when I notice that when I'm strong on my nutrients and taking my nutrients like I should, my kidneys are emptying correctly. I don't have any problems with them. If I get off the nutrients for a little while, maybe a day or two for some reason, maybe I got lazy and didn't take my stuff. And that's happened to me. It happens to all of us. Sometimes we, aren't as fastidious as we should be. And I start seeing problems. My urine will get cloudy and things like that. Clears right up when I get right back on the nutrients. Mm-hmm. Have you had that happen to you, Marvin?
You know what? I do. Matter of fact, when I first started taking these supplements, over 20 years ago, I went down that path. I fell off the bandwagon more than once, and I got back on it again. And it's human nature. It's human nature. But one of the things I've learned over the years, and one thing Dr. Wallach really emphasizes this: if you have elevated blood calcium levels, you're a high risk of developing kidney stones, according to Dr. Wallach. And this is what happens. That calcium-rich blood, as it comes back to the kidneys, guess what the kidneys are going to do? They're going to scrub out that calcium that they're pulling out of the bone marrow. And if you don't drink enough water, you become dehydrated, bingo, you've got kidney stones. All that calcium-rich buildup in your kidneys is going to calcify, and you're going to suffer from kidney stones. That's how kidney stones develop. Lack of calcium in your diet, and then all of a sudden the parathyroid gland recognizes that. It releases a hormone into the bloodstream. The red blood cells recognize that. They bring in that calcium out of the bones, and that's something else that happens. If you have elevated blood calcium levels, you're going to develop bone spurs. Guaranteed you have bone spurs, because wherever the blood vessels go into and out of the bone, that is a connective tissue. And when the red blood cells bring calcium-rich, they're laden down with calcium, and when they come out, it's kind of like that. If you have a hard water and you have a drippy faucet, you start getting that little white build up on your faucet, or you sprinkle.
Marvin, do you have one of my videos where we're discussing the remember those vertebrae, that we had?
Yes, yes.
Shows do you have that video that shows the degenerative changes when you show Dr. Wallach and he explains it and so forth?
I have to go look for it, but let me see. I'll tell you what, let me do this. Let me go and look at some videos. We talked about kidney stones, and then also kidney failure. As far as,
and also bring up the segment where I talk about the level that controls the kidney.
Okay, let me go ahead and get out of this, and we're going to go right into that. How about let's talk about kidney failure first of all.
Okay.
We've got bone spurs and kidney stones, and then bladder infection. We talk about bladder if we have time. So let's go ahead and get the first one out of the way.
Okay.
Kidney failure is one of your favorite subjects that you talk about all the time. And kidney failure basically means, and I heard you say it means that the kidneys, there's nothing wrong with the kidneys, it's just the kidneys need to be flushed out. Can you explain to us what kidney failure actually is? What is happening when we have kidney failure?
Well, doctors will diagnose you with kidney failure when your glomerular filtration rate, which is a measurement of how much filtration is going on in the kidney, goes down, and your creatinine levels go up. And creatinine is a measurement of a certain sort of amino acid complex that is easily gotten rid of in your urine when your kidneys are functioning properly. So when it goes up, your kidneys aren't functioning properly because it's not getting rid of it like it should. And so your doctor will say you have kidney failure. 99% of the time, when you have your creatinine going up and your glomerular filtration rate, your GFR, going down, you have kidney failure, but it's nothing wrong with the kidney. It's failure of function.
I see.
Not failure of anatomy or pathology of the kidney. What's happening is the dirty blood containing all the things you want to get rid of in your urine is not getting to the filtration units. That's because, again, medical doctors have a very simplistic view of life. The arteries in your body, let's say you have coronary arteries, you got plugged arteries in your heart. 2 millimeters of arteries plugged in your heart. Do you think that's the only place in your body where the inflammation is causing plugged arteries? No. You can also get plugged arteries in your brain, in which you get what's called avascular dementia or vascular dementia. There's no circulation in the brain anymore because there are arteries up there getting plugged. Caused by the same thing that causes plugging the coronary arteries. You can get glaucoma, which is plugging the little microscopic arteries in the eye, causing pressure to go up in the eye. And then you can get kidney failure, which is caused by obstructive artery disease in the little arteries inside the kidney. And so what we learned to do was to give a supplement program, which includes the 9 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And you give the other supplements to support and promote healthy blood flow through those obstructed arteries. Your body wants to heal itself. Now, suddenly, you're getting the dirty blood into the filtering units, where the filtration rate goes up, the creatinine goes down. Doctors say, I've never seen this happen. We had you on the kidney transplant list. We don't need to do this before. We've had people, Marvin, who haven't urinated, who haven't peed in 10 years. And normally it takes a couple of months for the circulation to work properly to the point where they're getting blood flow into the kidneys. The fastest I've ever seen it happen is 2 weeks. Guy hadn't urinated in 10 years. In 2 weeks' time, he's urinating. Another couple of months, he's off of dialysis.
Mm-hmm. You talk about creatinine level.
Mhm.
Creatinine is, now, what is it? Okay, I'm sure there's a certain number or a certain range, a low range. In other words, it's a certain threshold it gets to where doctors start concerned. What is that threshold? What is that number that we should be concerned about?
You want to be 0.8, 0.82 is where ideal.
Mm-hmm.
0.9, you're kind of getting suspicious. 1.0 is too high. 1.2 or 3, they're going to start saying, you know what, we need to put you on the kidney transplant list because this only goes one direction.
Mm-hmm.
And we need to get you on dialysis here when you get up to about 3 or 4 or 5, somewhere in there between 3, 4, and 5 creatinine level, they're going to put you on dialysis.
Mm-hmm.
You want to be below 0.85.
0.85.
That's where you want to be.
Ideally. But if it's, and so you're saying dialysis, you're looking at anything above 3, they typically want to
Start talking to you about it.
start talking about dialysis.
Well, if it gets to 1, your body's telling you you've got a problem.
Sure.
You get 2 or 3, you might have a reduced urine volume, maybe, but not all the time. Now, certainly, the kidneys are doing the best to keep up here, but they're not getting the dirty blood in there. It's kind of like an engine when the fuel pump is plugged with a lot of dirt because you had dirty gasoline going in the tank, and the fuel pump has a filter in it. And so the filter in the fuel pump is, say, 85, 90% blocked. What's going to happen to that engine? Is it going to run smooth? No. It's going to cough and buck and lurch.
Sure.
And not just black smoke will be coming out the other end.
Yeah. So I guess my question was, Doc, is this that if your creatinine level gets up to 6 or 7,
They're going to put you on dialysis.
Before they put you on dialysis, what are some of the symptoms that you and I can see without having an actual test? What are some of the symptoms we can see that would indicate that we may have a creatinine level problem or a failing kidney?
Well, your urine volume might go down. I used to pee 3, 4 times a day. Now I only pee once. And I used to pee again. Man, there's like a big tumbler glass full of urine. And now I'm only getting a tablespoon. So volume would go down, frequency
Okay.
would go down. But also you could be tired all the time. You could smell like urine.
Okay.
Your breath might smell like urine.
Uh-huh. What about water retention? Would that be another sign or symptom, or is that?
Not usually until the later stages. Okay.
Okay.
In the beginning stages, no.
Is there symptoms of people not feeling well or nausea, anything like that? Because if you get dirty blood, how does that affect you if you get dirty blood?
Well, you can have protein coming through in the urine. Sometimes as a signal. They do a urine test. You can do this yourself. You can test yourself once a month. It costs you $1.50.
Yeah.
To do a urine test with what's called a multi-stick, and you can see. And when you look in the book, Let's Play Doctor, in the home laboratory chapter, it tells you what to look for kidney function and urine tests and blood tests and everything, and numbers, what the numbers mean. And you can do all that with a multi-stick test, test your own urine for $1.50. You don't need to go to a doctor's office, but $80 for an office call. Then they'll charge another $300 for the lab work.
Yeah, Marvin, you need to show some of those sticks on the program sometime. Maybe
Well,
next
there's
time.
there's actually a video that has not been edited yet that goes through and teaches us how to do your own.
Oh, really?
Yep. Mm-hmm.
Yeah, we need to get that edited, don't we?
We do. Now here's the one on bone spurs. Let's talk about bone spurs here.
Yeah.
Okay. Hold on here.
Another symptoms of calcium deficiency or osteoporosis, Dr. Wallach, is bone spurs. And those can be very painful. So when a medical doctor has diagnosed with you or I with bone spurs, the first thing they want to do is what?
Surgery.
Why?
Well, because that's how they're trained to remove this offending spike of bone. We'll just snip it off of there and then it won't be painful anymore. But bone spurs are a symptom of a greater universal problem,
Mhm.
which is osteoporosis. And bone spurs, Marvin, don't occur randomly. They always occur. They always occur where a tendon or ligament hooks into the bone.
Okay.
When you have osteoporosis, your bones are not brittle. They're actually soft. When you get a fracture, it's not a snap fracture like a snap a chicken bone.
Mhm.
It's a folding fracture because it's just like a soft straw. The more weight you put on it, it'll
Right.
fold.
Mhm.
Okay. And so as these tendons, ligaments pull on the bone where they're attached to the bone, they'll pull the bone out and it becomes a spur or a calcium deposit.
Mhm.
It's not really a calcium deposit. That's what they call it from an x-ray because it came from somewhere else as calcium.
Sure. Sure.
And same with kidney stones. It's caused by raging osteoporosis. Parathyroid gland is pulling calcium out of the bones, and you get dehydrated, and all that high blood calcium will turn into stones in your kidneys.
So you're saying somebody has an elevated blood calcium level is high risk of developing kidney stones,
And kidney stones and bone spurs and calcium deposits.
and by not drinking enough water is
They got dehydrated and precipitated the kidney stones. Kidney stones are made from minerals that came from your bones, not from your diet.
I see. Has nothing to do with
You have a deficient diet or a diet that you're not absorbing the minerals from because you are gluten intolerant or you're not salting your food, which is what's necessary for your chief cells to make stomach acid so you can absorb minerals.
Right.
There's all these things happening. And when doctors start tinkering around with no salt, can't make stomach acid.
Right.
Then they say, oh, eat more whole grains. Well, if you're gluten intolerant, your villi go away and you
Sure.
can't absorb nutrients.
Sure.
And so most doctors should actually not talk about vitamins, minerals, or nutrition or diets. They have no training in it. They really should be prohibited by law to talk about it.
If somebody has bone spurs, so basically all we would want to do is just the basic 90 nutrients of body weight, additional calcium to the basic 90. And that's really all it needs to take to increase the bone density and reverse those the bone spurs.
Well, I'd throw in extra vitamin D3 and extra K2 and
Sure.
other stuff, which is, we can do this with supplement programs. And what happens is the bone spur just shrinks right back into the bone.
How long does that normally take?
Well, it depends on how big the bone spur is, how good your absorption is. And so I always tell people, don't sit there and watch the pot boil.
Mhm.
It might be 60, 90 days before you see something really remarkable.
Well, one of the things I want to mention, Marvin, on there that, and I think he might mention this in one of the ones where I interviewed him. If you can find one talking about the same subject where I interviewed him, it talks about calcium transport, where if you have osteoporosis, it will tend to transport it down to the area where those tendons attach to try to strengthen it to prevent a avulsion fracture. An avulsion fracture is where the tendon actually pulls away from the bone.
Yeah, what I'm
We
going to
see
do
that.
is keep talking.
We
I'm
see
going to
that
look for
quite
that
frequently.
video. Okay,
Yeah, what we see, avulsion fractures can happen in a whiplash accident. Where maybe your bone structure wasn't strong enough, and that head whips and it whips backwards, and it whips in a kind of an S-shaped type of thing. And I'll try to see if I can find a video clip of a whiplash accident. That might be a good thing for our discussion next time. I'll see if I can find one, and you can have an avulsion fracture from that. Because there's very strong tendons that go down the front of the cervical spine and down the back of the cervical spine. It's called the anterior longitudinal ligament and the posterior longitudinal ligament. Okay, and so you can get an avulsion fracture there. So
Dr.
all
Wiedemann,
kinds of things can happen.
I've got a question for you here. I got a video here. I think this is the one you're talking about. Chiropractors and nutrition doctor, chiropractic, bone spurs and fractures, calcium deposits, cartilage and ligament damage. Is that the one you want me to play?
Yeah. Mm-hmm.
It's only 38 seconds. It's very short.
Oh, I don't know. Show it anyway. We'll see what.
Well, or are you talking about the interview you did with Dr. Wallach?
Yeah, I'm talking about the interview I did with Dr. Wallach.
Okay, let me go back to that. Go ahead. Keep talking.
Okay, so yeah, and try to find the one where I discussed the level of innervation to the kidneys from the spine. I believe it's T8 through or T8, 9, or 9, 10, or 11, or maybe even 12. I think it's 9, 10, or 11. 9 and 10, I think, are the levels where the controls the kidneys.
Mm-hmm.
Yeah.
I'm just looking here. Oh boy, let me do a screen share, and then you can help me select the video here.
Okay.
So
All right.
bear with us. Let me do it. Let's do that. You might recognize it because I don't recognize which one you're specifically talking about.
Okay. And we talked a lot about bone physiology when I was talking with him, you know.
So here's the videos that you did with Dr. Wallach. Okay. Any of these look familiar that you're specifically talking about?
I'll bring it up and I'll see.
Well, you see this list right
I can't
here?
see him.
Do you see
Yeah,
the
let's
screen?
see. Bulging disc. Steady balance of the spine. Nerve. Try the one on vertebral subluxation and skeletal degeneration. Let me look a little more here. Medical doctors. Cabinet Perthes. Yeah, go ahead. Let's try that one.
You would play that one? Okay.
Yeah.
I learned something from you very profound this week, as you've been here and as you've been instructing me. And that's that, you picked this right up off of my x-rays, that there's a condition that's far more common than I ever realized. Because you picked it right out of my x-rays.
You're thinking of Paget's disease.
Yes.
And the interesting thing about Paget's disease, when you look at it superficially on an x-ray and you say, okay, this is Paget's disease because you can see it on the x-ray, and you think that's it. There's so many manifestations of Paget's disease, everything from low platelets, leukopenia, low white blood cells, anemia, because when you have Paget's disease, the bone marrow cavity fills up with connective tissue, bone matrix, and it shoulders out, it pushes out these cells that actually, and crowd out these cells that actually make red blood cells, white blood cells, and platelets. That's Paget's disease in the bone marrow cavity. It can happen in the ribs, it can happen in the vertebrae, it can happen in the long bones. This can happen in a child.
Mm-hmm. Because we're taught, from the very first that a vertebral subluxation is a vertebra that has lost its normal juxtaposition relative to the segment above, the segment below, or both, to a degree less than a dislocation, causing an occlusion of the foramen that a nerve passes through, okay, causing nerve impingement. Now, not a pinched nerve, but nerve impingement, okay? And that it can lead to a process called vertebral subluxation degeneration. Now, you saw some of my x-rays. You saw an 80-year-old lady. This can happen anywhere in the spine from all the way, from C2 all the way down to C to L to the sacrum, as far as that's concerned. And that it can narrow the disc. And you saw that this 80-year-old lady that I presented, that there was some spurring on the vertebra. Mm-hmm. That, the spurring basically reduced greatly, and the disc actually improved in thickness from about here to here. But what was the thing that you pointed out to me that that I didn't recognize on there?
Well,
you pointed out the skull and the rest of the spine.
Sure. Well, basically, her skull was almost an inch thick. Instead of being 2 millimeters thick, the skull was almost an inch thick. She had extreme Paget's disease in that skull. And also, when you get the nerve impingement, we're also getting blood vessel impingement. restricting the food supply to those vertebrae. Okay, so when you do an adjustment, you get better nerve function. You also get more blood flow, getting more nutrition to those vertebrae. And so you can see actual physical positive changes from an adjustment without changing the nutrition. But you're going to get this whole series. This is a series of stages of degeneration, and it's all caused by nutritional deficiencies, either from obstruction of the nutrients getting into the vertebrae or from just it not being in the diet.
What is trabeculation? Let's talk about it for the laypersons. What is trabeculation, the trabecular part of the bone?
Well, you're talking about a microscopic look at the bone here. You're talking about the structure of the minerals inside the bone being laid down in the rebar, if you will, of the bone matrix.
Mm-hmm.
Okay. And as you march from a normal vertebrae down to one that's severely impacted, it's going to be more bone matrix and less minerals. Okay. And so you're going to see the rebar more than you are seeing the minerals.
Mm-hmm.
And so that would be my definition of trabeculation.
Is there another term for this condition? See, we see pretty stout bone here.
Mhm.
And as it moves along here, what would this condition might be called, on the general basis, where there's demineralization?
Well, it could be osteoporosis,
Mm-hmm.
osteopenia in the earlier stages.
Right.
This can occur in a newborn baby.
Mm-hmm.
It's called osteogenesis imperfecta in a newborn baby, and doctors will say this is genetic.
Mm-hmm.
No. Mama was deficient in these things, and the deficiency, of course, impacted the development of the embryo.
Mm-hmm.
And so osteogenesis imperfecta is a infant's and embryo's manifestation of these same things that you would see commonly in a 70, 80-year-old person.
Mm-hmm. Now, I was taught that after age 25, the disc itself loses its blood supply and only receives nutrition through the end plates of the vertebra. The bare marrow on the plates of the vertebra actually causes nutrition in these discs, whereas those main arteries dry up. As you see these vertebrae going toward this direction, so you see the disc doing the same thing. So what's happening in there?
Well, again, as the Paget's disease occurs or osteoporosis occurs, because Paget's disease is really kind of an advanced form of osteoporosis, this extra bone matrix, this rebar, if you will, begins to close the foramen, begins to close the holes, the tunnels, the canals that the nerves go through, but also the blood vessels go through. Okay? So as it restricts the blood supply, it's also restricting the food supply, which results in this pathogenesis here, which results in a series of degenerative processes.
Okay, now what causes these spurs to form?
There's ligaments and tendons hooked in here. There's connective tissue. There's a joint capsule all pulling on the bone. It's kind of like making lemon meringue pie icing, if you will. It starts out flat, and you can take a butter knife or a little spatula and do this, and a little pin will come up.
Mm-hmm.
Okay, the same thing here. When you get bone spurs, when you get calcium deposits, what's happening here is where there's a connection with either the joint capsule, the tendons and ligaments involved, they pull on the bone, and the pressure, the tension on that bone results in what we'd call a calcium deposit or a bone spur. The nice thing about it is replace all the nutrition, get the blood supply going, and those bone spurs and calcium deposits will just melt right back into the bone. So you don't need surgery.
So what you're basically saying is when you have a severe osteoporosis here, that in order to keep that ligament from pulling away from the bone, it has to shore up by building a spur bridge in there to keep it from pulling
Away. That's correct.
Yeah. Okay. And so in the process, not only does the bone degenerate, but the disc degenerates also. Okay.
Because the disc need 90 essential nutrients too.
That's right. And even though you might restore the balance of the spine, reduce the stress on the spine, and maybe see some of those spurs not so prominent anymore because the stress is gone.
And the blood supply is improved.
And the blood supply is improved. You're just taking the stress off the spine. You're not really rebuilding and laying down that calcium in there.
That's correct.
And how can this affect the nerves? I mean, we see here that there's a very healthy nerve right here. And as the nutrition, the stress on the spine increases, this nerve actually gets embarrassed. And then as we look here, we can see that the changes in the bone actually cause some encroachment here.
And the nerve gets smaller.
Until it's like this. Okay, so If you're just adjusting the spine, I mean, that's going to help. But is it possible that there's something called a nutritional deficiency syndrome interfering with nerves?
Of course. And it can manifest itself, again, many ways. When you look at the neuroanatomy of a human being, there's 12 cranial nerves, which each nerve starts out in the brain, goes through a canal to the outside. And when, say, for instance, the seventh cranial nerve, the facial nerve, gets squeezed, this is coming through the skull.
Yeah, we're talking about the skull right now, and the holes. Now, that's another thing I wanted to bring up, Doc, is the fact that, yeah, we talk about where the nerves come out here, but the cranial nerves come out of the skull.
There's 12 pairs.
Now,
12
how
on
do you
each side.
adjust that, Doc, with when there's no vertebra involved, and yet there's holes there that nerves pass through, and they're getting squeezed? What do you do?
Well, there's multiples of bone in the skull, right? And there are skull adjustments, cranial adjustments. That's possible. Chiropractors do it, osteopaths do it, naturopathic doctors do it. And so that's a possibility too, to get some relief. But you have to, again, take all 90 essential nutrients, the optimal amount for their weight. What happens then is the bone re-architecture is back to normal. The bones want to heal themselves, including the skull bones. The skull bones get osteopenia and osteoporosis too.
And Paget's disease.
And well, Paget's disease is an advanced form of osteoporosis. And again, most health professionals look at osteopenia and osteoporosis in the long bones, the legs, the vertebrae, the pelvis, and they kind of discount that disease going on in the skull. And of course, dentists know about this because you get a loss of bone mass in your skull and your jaw. You get receding gums because there's nothing for the gums to sit on, so gums recede, and you lose your teeth.
Hey, Dr. Wiedemann, that's a really good explanation. What happens, not just a lack of calcium, but all these different skeletal issues that will develop along with organ failure, like such as the kidneys.
Well, Marvin, I think what he gave there is a very good explanation. Our discussion was really good because it showed that there is a need right along with correcting the spine. There needs to be nutrition right along with it because it supports everything a chiropractor does. Now, everything a chiropractor does is going to enhance, just like you said, an adjustment enhances nutrition by itself without any supplementation. But how much better can we have it if we have the best of both worlds and have all 90 essential nutrients being supplemented right there? And I believe in supplementation because, the problem is that our soils just don't have the nutritional value in them anymore like they used to have years ago. You take a look at videos from people years ago, they were much healthier than today simply because of all the minerals in the soil. So now I want you to bring that list of the spinal levels, if you would, please.
Okay, let me go ahead and do my screen share again.
Okay.
And
now I want to say this, that through the years.
Are you talking about this list right here?
No, the next list. The one where it shows the levels.
I'm not quite following you.
I think that
is that underneath the. Let me look at the. Hold on here.
Right there.
Let's see if this is the one we want to. Is this the one you were talking about?
There we go. Let's go down to T9 and T10.
T9 and T10.
Yeah, T10 and T11. T10 and 11.
Okay. Can you see that?
Yes, I can.
Okay.
Okay, we just covered the T9 vertebra. Now we're going to talk about T10. T10 controls the kidneys. And the problems in this area can be kidney problems, hardening of the arteries, chronic tiredness, nephritis, and pyelitis. And if you are having these problems, these are very serious problems. So in order to prevent and reverse this type of problem, Dr. Wallach endorses and recommends regular chiropractic care along with a specific protocol for healthy bones and joints.
Okay, so we got that one. And then the next one we want to watch is
T11, and that is going to talk about the ureters, you know.
reader. Okay.
Yeah.
Okay, we just talked about the T10 area, which controls the kidneys. The T11 area, very similarly, controls the kidneys and the ureters. Now, the problems in this area are skin conditions, such as acne, pimples, eczema, and boils. If you're having trouble like this, first of all, Dr. Wallach recommends regular chiropractic care combined with his specific protocols for healthy bone and joints. He might also support it with nutritional support for the kidneys.
That's a little short and sweet.
Okay, now Marvin, I want to bring up the fact that you remember we talked about healthy bones and joints. I think that if we go up to the top here, structure of the vertebra, healthy bones and joints. Go ahead and watch that one right there.
Okay.
I want to bring an illustration about the difference between in healthy bone and joints versus unhealthy bones and joints. Okay, what do you see? If you'll take a look here, you'll see a relentless process that happens in the wear and tear and breakdown of those joints. Well, let's take the most extreme view here compared to the healthy one. What do you see happening different in this one that you don't see in this one? Well, there's actually several disease processes going on here. You've got arthritis, which is inflammation, and you have osteoporosis, you have degeneration of the disc. This is often called degenerative joint disease, but there's several diseases going on. There's also spurring that happens, okay? Well, what is arthritis really? Well, arthritis means inflammation of the joints. Well, what happens with inflammation? Inflammation is actually simply the body's attempt to use its inherent recuperative powers to heal. Question is, why is it not healing? Now, there's several processes in the healing process with inflammation. In chiropractic college, we learned it was rubor, tumor, dolor, humor, redness, swelling, pain, and seepage of white blood cells into the tissues to take up dead and dying tissue and to fight inflammation. That is a healing process. In other words, the body has inherent recuperative powers that it's attempting to use to heal this process. Okay, so the question is, why did it go this far? Well, the answer is simply because the body did not have the resources to rebuild the joint. You see, repair and rebuilding is going on in the body all the time. Why is it this is a healthy joint and this is not? It's because this joint has the resources to constantly be remodeling, rebuilding, and keeping it in good shape, maintaining it in good shape. So in rebuilding these joints, it's far smarter to provide what's necessary to repair and rebuild those joints than to let it go too far. What is the medical industry's answer to this situation? It's to provide painkillers, anti-inflammatories, and eventually surgery. Those are the only answers they have. In the animal industry, they spent millions of dollars in research on this problem. And what they discovered is nutritional formulas that would support healthy bones and joints. And what Dr. Wallach did was he took those same nutritional formulas that came from the animal industry, the millions of dollars of research in the animal industry, and applied them to humans and found it works like a charm.
Okay,
Doctor.
Marvin. So that was a good explanation. Also, it was a little more direct. We didn't get so much into the adjustment with that, but Dr. Wallach covered that portion of it. So keeping the spine corrected. Now, if you take this approach, you can if you know anything about longevity and what you should do, you can. This is why the healthy bone and joint protocol is so popular, because if you're seeing a chiropractor, he's correcting your spine, and you take the healthy bone and joint approach, you can target an organ that way by removing interference, and then taking the healthy bone and joint to surround and protect the disc. So that's a choice you can make. I mean, we have lots of approaches we have a more direct approach. Like, for instance, there's a secret sauce for the kidney itself. You can add that to your protocol if you want to. But this is why it's so really important to be on healthy bone and joint protocols, no matter what your condition is.
Well, Dr. Wiedemann, for those of you who have never heard of my testimony, after 20 years in the Navy, 17 of my 20 years as a Navy SEAL, I did not supplement based on Dr. Wallach's protocols. During my time when I was deployed over in the Middle East, I spent a lot of time over there in the first Desert Storm. I sweat out I drank a lot of water. I sweat out a lot of nutrients. So by the time I was in my late 30s, I had major skeletal failure, degenerative disc, arthritis, bulging discs. And as a result, it led to my 100% permanent total disability because of service-connected disabilities. Of the 19 service-connected disabilities I was awarded, 15 of those, 10% or higher. And I want to say, I think all of them have to do with the musculoskeletal except one of them. And so with that said, I did not know about Dr. Wallach's message. I learned this after I retired. And so, yes, I take those supplements, but the VA, when they diagnose you with osteoarthritis or arthritis, they say it's permanent and progressive. And so I'm just thankful that I have Dr. Wallach's the 90 essential nutrients and the healthy bone and joint protocol, because I'm able to slow down that permanent and progressive deterioration of my skeletal system. And so with that said, I'm 65 years old. I'm not on any medication, but I tell you what, if I don't take that supplements, it won't take long before I start really feeling it. I really feel those bones.
So how much effort do you put into the bone and joint portion of your existence right now?
Hundreds and hundreds of dollars, because I do not want to be in a wheelchair. I will do everything I can to slow down this process. Now, the other thing is, because I did a lot of mixed gas diving and pure oxygen diving, the long-term negative side effects is a major deterioration of the skeletal system. That's actually documented through the VA, people who actually review your disability. But with that said, so I am very aggressive with making sure I take.
When you say mixed gases,
products.
Are you talking about like inert gases that you had to have, or
helium, oxygen, and nitrogen?
Yeah.
We would dive mixed gas, Mark 16 and Mark 15. Those are all mixed gas diving rigs. But also I did hundreds of hours underwater with pure oxygen, which is no bubbles. And so pure oxygen to the skeletal system, I was part of this research back in the Naval Safety, Panama City, Florida, back in 1985. We did a experimental diving regarding pure oxygen diving. And as part of that research, that's actually funded by the NIH, National Institute of Health. And Dr. Butler, Captain Butler, was part of that research. And he was a diving medical officer, but also as a Navy SEAL. And it's well written up, well researched, documented that all Navy divers and special forces who dive in mixed gas and oxygen will suffer exponential skeletal deterioration in later years. And I can be a personal testimony to that. Now, with that said, if you're listening to me, know somebody in that category, I load up with extra. I mean, I have to take 2-3 times more than the average person does to see the same benefits, but I can actually slow down that process. Slow down that process.
Marvin, I was going to ask you, did you ever find your pipe?
Which one? Oh no, I haven't. I haven't even had a chance to look for it.
Do you have your cover handy?
I don't. It's back in the no. It's down in the garage right now.
Okay, I want you to show those on the show sometime. You know,
Oh, you
next
want me?
week
Want me
maybe.
to wear my? You want me to wear my bad boy hat?
Yeah.
Okay,
Yeah, I
can
want you to
do
wear your cover and bring the pipe out. And next, we'll start the show with pipe next time. You know, everybody comes
well,
on board.
I won't be. I will not be here next week. I'll be actually. You're going to be doing this on your own next week. So you're going to have to bring your pipe out and
Yeah,
bring
that's
your
all
bad
right.
boy
That's
hat
all right.
out.
I don't have a pipe. I wasn't in the Navy, you know. So
Well,
and
but with that
no,
said, those of you who are listening to tonight's show, I hope you enjoyed what we had here. A kidney, as Dr. Wallach said, do not allow them to remove your kidneys. There's no need to be on a kidney transplant.
or your bladder.
Or your bladder. And I just,
And one of the things I wanted to mention is if you have been seen to have mass in your bladder, the first thing I would recommend is getting on the Paraclear and getting on the 90 essential nutrients right away. You know, it's very possible that that mass could clear up in just a couple weeks. You know, and you might as well give your body a chance. You know, you can't promise it, but you know, it's very, very, very likely that there's parasites there, and you can go after those parasites. So, with that, I want to say, Marvin, anybody that claims to cure, there's only 3 people, the 3 that claim to cure, that will tell you the truth, and that's the butcher, the tanner, and the tobacco farmer.
Well, with that said, we have so much more information to share with y'all, and just heads up, thank you all for watching. And we actually had a good time tonight talking about the skeletal system. And I'm sure there's a lot of people out there have questions. Well, how can we get a hold of you, Dr. Wiedemann? Why don't you let us know how we can get a hold of you if they have questions? And what we do is we actually make sure that HIPAA privacy is exercised here. And there's a health assessment that we actually have you fill out. And Dr. Wiedemann can take you through that with a health assessment. And we don't charge for our consultation. It is free. This just like
we should, but we don't.
No, we're not doing that. And so my point is this: Dr. Wiedemann, he's a licensed chiropractor. I am a consultant, and so I do not charge for my time. Neither does Dr. Wiedemann. But what we do is we teach you how to help restore and repair and rebuild your body. We teach you how to give the body what it needs so it can heal itself. Remember this. Just remember this. Dr. Glidden, he coined this phrase, healing is easy. And I want to give Dr. Glidden where credit is.
We want to give Dr. Glidden, you know, it'd be fun to have Dr. Glidden on here sometime.
Dr. Glidden is a staunch supporter and promoter of Dr. Wallach's nutrition protocols. He came up with that phrase, healing is easy. And all you have to do is give the body what it needs and it will heal itself.
That's right. That's right.
And Dr. Wiedemann, can you let us know how to get a hold of you?
Yeah, 406-270-3754. And by the way, it helps us if you hit that that subscribe button and the like button down there, the thumbs up for us. That really helps our algorithms. You know, otherwise we're getting cut off, and you know, very few people are being able to watch us. You know, so. And a lot of people are asking about where is our program? Where's the program? We like to watch you every night. And, good old YouTube is restricting us somehow for some reason. So, okay. So with that, good night, everybody.
Bye, everybody.